Good afternoon. My name is Carrie Foster. I'm a mission supervisor at Freeman Health System. My employee here with me today is Heather Cobine, and she is a navigator for the marketplace. Today we're going to just share with you what we do at Freeman. We're a new program that started in May of this year, and I have had the absolute blessing and opportunity to do what I love to do and do it in my place of employment. So we found that there was a need with our patients to be able to help them find what they're eligible for. So our Eligibility Partners program was developed from our desire to meet the needs of patients. It starts with insurance. It starts with having a pay source to be able to pay your bills. It also goes into housing, food stamps, connection with treatment. Sometimes they need treatment outside of just the regular facility. We help with that. We help with getting them in contact with the community resources that many people don't know exist. When they meet resistance, they don't have vehicles, they don't have the ability to get to those places, then they're unable to be able to utilize the resources that we find in the community. So for us, this is what we do. For our patients, we utilize our social workers within the Freeman system and within the community that deal with maybe through Medicaid, through some of the other resources in our community. Legal aid, we work with legal aid for those our patients that have met the income guidelines. If they have need of legal help, sometimes it's appealing, sometimes it's going to court for our denial. Maybe they got a denial for their insurance that we've applied for. Legal aid will also come to our bedside. So if we've got an issue, we've got a patient that is in need of legal assistance, we can actually get an attorney to their bedside to help deal with their legal issues, which as we'll talk a little bit more moving on in the presentation, our goal is to take care of this stress to help the patient heal. We all know if we're struggling with our finances, we're struggling with things of that sort, it's hard for us to heal physically. It affects on both sides. We do have a Freeman Financial Assistance Program we'll talk about here in a moment. The Affordable Care Act, which is our marketplace insurance. I'll share some more with you about that. Medicaid, other community outreaches. We also deal with dual coverage, which means that maybe we've got a Medicare patient who has Medicare only. What not everybody knows is Medicare does leave a portion of the bill for the patient to pay. When you've got a patient who's on a limited income, just like students deal with limited income, so do adults, older adults. So we go in and help them find a secondary insurance to allow those coverage benefits to be paid for. So like if they have a $2,000 copay for a hospital visit, that secondary will come in and cover that and relieve that financial burden. We do state-funded grants. We watch for what's available for patients. We actually have a whole department at Freeman that deals with grants, and they help us find money that is available through the government or private entities to be able to help patients pay for their portion of their bill. We work with insurance. Very often somebody's got insurance, but there's been a problem, and so we do just what has to happen. We get on the phone and we discuss what is needed with that patient to allow the insurance to cover the way that they need to. So we really do take a full approach.
Is COB coordination of benefits?
Coordination of benefits. And what that really is, let's say you have a car accident and you come into the hospital and you're coming in for an x-ray for back pain. Your insurance is going to say, your health insurance is going to say, is this related to that car accident? Because we want the car insurance to pay, we don't want to. Thing to remember about insurance itself is it's a risk-based business. And what that means is they want to pay the least amount of money that they can. And their whole business is about risk. And so if they can find somebody that will pay for it before them, then they absolutely will find that. So that's what that coordination of benefits, sometimes they think you've got another insurance. Sometimes it's just, they have some questions about what is going on, you know, and until there's a full diagnosis, they're gonna be asking some of those questions. Freeman, our vision, as I spoke a little bit to earlier, is a holistic approach. The financial health of our patients is very important to us because we do know and believe completely that if you've got the stress of the finances and you don't know if you have a $6,000 a week infusion, or if you have a 35-day hospital stay, which happens on a regular basis with like an accident, or you know, how are you going to take care of that? You're not going to heal in a manner that is appropriate because of the stress that goes on there. So we believe that our piece is almost as important as the physical. The physical health is so vital, but if we don't have our finances in order, that stress can cause great difficulty for us. So that's the approach, that's where our vision came from for this. We are committed to advocating on behalf of our patients. We actually come in, we do what's called a designee form, and we act as an advocate for that patient. We can actually go to Medicaid and speak for you. We will maneuver through that Medicaid system, which can be very, very confusing. So we actually will maneuver through that. We deal with Medicaid. We have partnered with Medicaid, and we have access to get into the system to be able to upload our information into the system through an email and get that application approved.
You said you do a designee form?
A designee
And
form.
is that where your patients sign, giving you permission?
Giving us permission to represent
them.
them. And it's absolutely, that is a legal form, and it is designee to be able just to handle these applications. It doesn't give us, you know, any access to anything, but it gives us the ability, for instance, you've got a patient that's in the hospital, maybe they've had an accident and they've had a hip replacement in that process. Well, they can't drive. They can't drive for X number of weeks. How are they going to provide bank statements to Medicaid? So we, as their designee, will step in, we'll get a hold of the bank, get that information, and we can keep that Medicaid application flowing. We have had phenomenal success. In our prior adventures, we were taking as much as 6 months to get an approval for Medicaid. And our average Medicaid approval is 30 to 45 days. And that's really, actually, I'm bloating that just a little bit, where we've got such a great relationship with the state dealing with the Medicaid piece. So we are highly trained in knowing, we don't take an application that we don't think is gonna go. To kind of give you a couple of our success stories with Medicaid, to kind of show you how it's all inclusive. We had a gentleman that had been in another facility. He has a prosthetic right eye and going blind in his left eye, and the other facility refused to take a Medicaid application because he'd have a spend down. And a spend down means you're covered by Medicaid, but you have to spend X amount of dollars a month before it kicks in. Kind of works like a deductible with insurance, but it's a little bit different. But he was going to have a high spend down, and they refused, told him, no, we won't take the application. And so they got a hold of me, and we got moving, got his application through. Not only did we get a Medicaid approval, he did have a spend down that was half of what they thought it was going to be, but because of his blindness, we were able to get him approved on a program for the blind that pays the spend down and pays his premium for his Medicare, and he will get a blind stipend. But the other facility refused to do that. Yes, sir.
Now, you've been saying Medicaid, and then you just said Medicare.
He has Medicare as well. He has primary because of his disability. And that's a prime, if there's anything that's a disability, that's almost, not always, but almost an automatic Medicaid approval. But this particular patient had primary Medicare, so it paid first. But like an inpatient stay for Medicare leaves the patient with real close to a $2,000 bill. And for someone on a limited income, that's impossible. I don't, even if you took $25 a month from that patient, you're taking grocery money. So we look for everything. I will tell you right now, we are really focusing in on our Medicare patients. We're an open enrollment for Medicare. And many of them, again, if you don't do insurance, if you don't work in this field or have experienced it, it's another language. It's totally another language. So you've got adults who are struggling to pay their bills that have never struggled before, but they're on that fixed income. So with this particular patient, he had Medicare primary, and Medicaid is coming in and meeting a need that they didn't even know could be covered.
So Carrie, how did you know to contact? How did you even know there was a stipend available for blind people to contact that organization?
Well, that's what we do. That's what we do. We dig and we read. You would be surprised. I am not a good reader in the fact that I don't read for pleasure. But you'd be surprised the fun things I've been reading over the last year and a half. And we'll go in and we research, we get updates. Again, we have really forged a great relationship with the state, and we have people who give us that information. We have updates all the time, and we work. We have triggers. There are some triggers that say blindness is one of them. Someone who has epilepsy or seizure disorder, that's a really quick approval. Now, I want to put my little asterisk here. I certainly can't stand here and say this is what's going to be approved, but this is what we commonly see.
And when you say approved, do you mean approved for disability?
Approved for Medicaid.
For Medicaid.
Mhm.
Okay.
Yeah. And that's another piece that we have added to our program. We didn't start by doing Social Security disability applications, but we've added that. In January, when the administration changed, if you all maybe heard about, they were holding Medicaid more accountable. For a lot of years, we could shoot an application in. They didn't ask for as much documentation, but now they are, which I'm fully supportive of, because we should know that people are getting what they need for the right reasons. But with that, for adults and people of this age, what you would run into is they have to apply for disability. So what we do is we do that disability application with them on the spot. We go right to the bedside. So let's just pretend you all are laying in a bed for whatever reason at Freeman. We will come to your bedside. We will sit there with a computer. We will do the application with you. We will do that with Medicaid, depending on the situation. We've gotten approval sitting right there in the patient's room. So, it just depends on the scenario, but we will do this right there. So we now do the Social Security application online. As the patient's designee, we can do that. Now, there's no magic pill. We don't have any magic wand or any special thing. We have knowledge and we understand the system, but as that designee, we fill out that online application. As I'll talk a little bit more about our marketplace, every one of you can go online and do your own application for marketplace. But when it gets to the place that you're talking about your tax credits, how do you consider this? What does this question really mean? That's where we come in and we can help answer those questions to make sure that you get the best benefits possible. Okay? Kind of give you a marketplace story. We had a young couple that I had come in contact with when I very first started this program, and sweet young couple. As a matter of fact, I think that at least one of them graduated from Missouri Southern, but they were about to have a baby, and They were very, very nervous about what was going on, and to add her family to her insurance was going to cost them $950 a month. I don't care if you make good money, that's a lot of money. So we got in, they had the baby, which is a special enrollment qualifier. You know, when it's not open enrollment, you have to have a reason to need that insurance. And we'll talk about that a little deeper here in a minute. But they had the baby, so I sat down with them. We did the application, and they were eligible, and with their tax credits applied, they actually got insurance for $450 a month for dad and baby. For dad and baby, they didn't have. She was covered on it. Her plan was good, adding the family. So, you know, for some of us, $450 sounds a little bit high too, but when you think they were looking at $950, you know, it's a $500 a month savings. So there's great coverage out there available. You just have to know what you need. And that's the piece that we play, is because of the education and the knowledge that we have, we're able to say, I think you've got these qualifiers for Medicaid. Let's look at that. Or there's nothing. Let's look at Marketplace and let's see what we can do there. Okay? Again, we take that holistic approach. We have probably a dozen families that we have helped with food stamps and additional things, help with electric bills. And we certainly can't do it all, but we can get people in contact. Not sure, I have been asked to help someone pay their cell bill. I'm not sure we ever got that done. But we do, and we've had even some other requests where they're, you know, someone's laying in bed, their spouse was very sick on hospice, on our palliative care, and they had a water main break at their home. And so we got in contact with some people, and we got somebody out there and through a charitable program and got that fixed while the wife could stay here and be with her husband who was dying. So like I said, that's right. You know, and here's the deal. I feel like I am probably one of the luckiest people on earth, because I have been able to be involved in a program where my heart, the things that I love and enjoy doing, I now get to do it, and I'm getting paid for it. But I get to lead this team who step into the lives of these people, and we get to show compassion, and that's what we do. You know, we can help some people, and some people we just can't. There's just not there, but we can get you people in touch with people, the right people.
So I'm going to ask a sidebar question.
Sidebar question,
So
I
now
got you.
I'm thinking about students, and they're going to be graduating with degrees, and so how many eligibility partners are on your team, and do they need to have a college degree, and in what area should they have that degree, and things like that? Social work, I hear a lot of social work.
Yeah. That's a great question, great sidebar question. I'm proud to share that with you.
Okay.
At this time, I have 6 eligibility partners, and they come from all walks of life. A college degree is encouraged, but not mandatory. What I kind of share with you, one of my specialists or partners comes from the Marketplace. He came to us, kind of absorbed into our program from last year's just plain Marketplace. That's all they dealt with was the ACA. I have another one who has been in admissions for several years, so she's dealt with the registration piece, so she has that piece of it. My navigator, Heather, came from sales, and bless her heart, she came in with no hospital knowledge, and she is phenomenal. She has learned so quickly. I have another gentleman who works for me that has been in management and has been at Freeman for many years, done multiple things within the system. I have another one a young woman who works for me that spent 9 years in social services at DFS, and then another who has been in admissions for 9 years. So we kind of do that. Our goal will be that I really see the team by the time we've hit max at about a 12-member team. I do expect to increase what we do. We have a 5-year plan to be visiting physician offices, to be able to be more mobile, because we are out and about visiting patients in the doctor's offices, clinics, anywhere we need to go to meet the need of the patient. We do cover Neosho now at our Neosho facility. Anytime we have anybody there, we can go, that we can go there.
And do you hire full-time only?
At this point, we're full-time only.
And do you have any openings currently?
I do not have anything
I have
currently.
someone in mind.
That's right, we'll keep them in mind, but I
Okay.
do not have anyone, I don't have anything currently. I will tell you that right now, we are Monday through Friday. We cover the hours of 7 to 7, 7 a.m. to 7 p.m. But I expect that will expand. They do one Saturday. It doesn't always work out every 6 weeks, but they do one Saturday. They rotate those Saturdays.
Thank you for letting me take you
I
down the
love it.
side
I
road,
love it.
but
Sherry-
Always looking for career opportunities. for
Absolutely.
students,
I think
so.
that's a great, I hadn't even thought to go that way, but absolutely that's great. This is expanding. We actually, with our grant program, the marketplace grant ended in July. I think July's right. The end of July was it. And part of that grant from the government was to sustain the marketplace. The marketplace, I think it was 5 or 6 years that the government paid for that within the systems. And they now say you need to be able to sustain that. A lot of facilities don't have the opportunity to do that. We had a company that we paid to take Medicaid apps. That's what their business is. And you know, when you have someone from another state who's in your facility, they don't have the ownership. Now we've brought it in-house. We're able to build it because this is our family, this is our community, and we want to meet the needs of that community. We're bought in because it matters to us. And so that's where the drive came to fix this, because we wanted our patients to be taken care of in a manner that meets our community needs. And so I'm always willing to talk about this. My family would actually ask me to tell you all about it and then not have to hear it again.
You're very passionate, I can see
I am
that,
very
so.
passionate about it, and I love what I do. We continue to monitor the application. So we take that application very, very seldom. Once in a while we get an immediate approval, but we can't always. Sometimes there's additional information needed that we cannot obtain in that moment. So we monitor that application. I can tell you we monitor that to end and beyond. This is one of the reasons we are partnered with legal aid. If we get a denial that we don't believe is an acceptable denial and we can't get it through, now I don't like to let things go, so I will tell you that I fight those denials pretty hard. But if that happens, then that's where legal aid steps in, and then they will represent the patient and get and see what we can do from that side. So we monitor these very closely, and then once the patient is approved, then we get that information to them, and then it's kind of like the circle of life a little bit. We're here for the patient, but we're here for the facility as well. Pay sources are important. Coming from that educational side, a business is a business, right? Doesn't matter if you're profit or not for profit, you're still a business. But we enjoy, here in Joplin, we enjoy exceptional health care for this small area. And we do that by being financially responsible. So yes, we're here for the patient, and that's our passion. But we're also passionate about the facility being successful, because when the facility is successful, then we know we've got the health care that we need, and we're not having to drive to Kansas City all the time. You're not having to drive to Springfield to get coverage or to get the treatments that you need. It's right here. And so we take that very serious, because if we don't get pay sources so that we can continue to grow within this community, then we will not have the benefits that we have now. So we work on that. One of the other things that is really phenomenal for us is that we have the ability to do a presumptive Medicaid, which means, let's say we have someone who comes in and they are 15 weeks pregnant, they've not seen a doctor yet, and they come into the hospital, we monitor them, realize that they're in need of Medicaid. We can actually do the application. If they meet the right criteria, we can actually approve them for Medicaid in that moment. And that's not even a big deal to the facility because we can go back 90 days with Medicaid. But what that does is that gives that expecting mother the opportunity to go to the doctor, and Medicaid help her cover that. It gives her the opportunity to get her meds and things that she might need in that pregnancy for that moment, not having to wait for that approval. So that's an excellent, that was one of the big things that we were so excited about when it came time to do this, because the state does not partner with other companies, but they will partner with the facilities. So we've had a great opportunity to work with the state, and it's been a super relationship.
Does the patient need to be a current patient in the hospital to contact you?
No,
Like I'm thinking of a lady I know that just had breast cancer surgery and she's now home.
yes,
I'm confident she is not aware of all these services that are
absolutely.
available to help her.
We have flyers, take one
Okay.
and give that to her, and she can call and make an appointment. Come in and we'll make it for what works for her. Like I said, we're there till 7 o'clock at night. If someone can give her a ride later than that, someone will be there.
I have another situation, single
Sure.
mom, 2 girls, been very healthy, 30, been very healthy, suddenly losing weight, throwing up, blah, blah, blah. Was enrolled in a private insurance company through a religious organization, thought she had coverage, goes in the hospital, she's had all kinds of tests run, she has a $40,000 hospital bill now. The insurance she thought she had has now determined that was a pre-existing condition. So she's under the belief that she can't qualify for any charity programs because now she doesn't have health insurance. Because she said, why am I paying you then if you're going to say it's all pre-existing, why am I paying premiums?
Yeah.
So she thinks she can't get any help now because she doesn't have insurance.
Single mom, 2 children.
Single mom, 2 children, elementary age.
Depending on her income, she may qualify with that, and whatever we find as a diagnosis, she may very well qualify for Medicaid, family Medicaid. Maybe a limited program, but then anything that would not cover. If she or the children were approved for Medicaid, chances are they're gonna get approved for financial assistance.
And I
So,
think the children get some kind of Missouri insurance already.
yeah, she's probably, if the kids are on Medicaid already, which that probably is what they're on, she probably could qualify for some type of a family Medicaid. So absolutely, have her contact us, we'd be happy to help
Okay,
her.
I'll do that.
Absolutely. This is as much a community outreach as it is a Freeman outreach. We obviously, we would love for you all to choose Freeman. It's the best place to get care, in my opinion. But on the flip side of that is we're gonna help our community. And if we help the community, then we are helping Freeman. So I've hit on Medicaid. Does anyone have questions about Medicaid? Primarily the
And Medicare is based on your age.
right. The easy way to remember this, Medicaid is for children. In quotations here, we're gonna say sick adults, depending on the scenario. And then Medicare, we have to care for the elderly, so Medicare is the one that's based on your age and disability. So Medicaid, when the changes were made to the insurance and the marketplace and the ACA was brought about, they did open up Medicaid to a larger group of people. And that's still available. That was not abolished with the new administration. But what did happen was the new administration said, if you need assistance, you have to prove you need assistance. We're not just going to give it because you think you have a disability. You've got to prove that you do have some type of a disability. So, very good. And not to say that no adult is on Medicaid, because we do have Medicaid for family. A situation like this where you've got a mother who has something wrong, if something serious is going on, Medicaid's gonna look at that and say, because you can get Medicaid depending on the diagnosis as well.
I have a question.
Yes, ma'am.
So for students who don't live in this state, or just here for like spring and like fall semesters, and what if they have like home insurance back home, or what if they don't have home insurance back home, either or something like that?
Well, most of that primarily would fall under our financial assistance, which I'll talk about just a little bit more in depth. Depending on the situation, we are, let's talk Medicaid. Let's say they're on Medicaid in their home state, okay? We will file claims to that state for that patient, for that student or patient, they're both the same. But if somebody is here living 9 months out of the year, we'll sit down and we'll evaluate what's the best thing to do. Because sometimes, and we've had this situation, sometimes it's better to stay with your home state Medicaid. They'll pay the same, it's no big deal. Sometimes the state says, you're not contracted with us, we're not gonna pay any of your bills. So now you're stuck with these bills, and we'll have to evaluate that at that time. Now, I've had some people who have changed and applied for Missouri Medicaid because they're here 9 months out of the year, that it's a better option to get things paid. So that, unfortunately, is not an easy cut and dry answer. We'll sit down, we're gonna look at every variable and see what's going to be the best. And then a lot of the students end up with a financial assistance because, you know, there's really no qualifier, there's nothing, thank goodness, going head on serious physically. So we don't want to, you know, there's just not anything there to get that coverage. Did I hit on that, your answer?
Yeah, like back home, I don't think I'm on that anymore. I'm not sure. I'm on family plan
Okay.
right now, but it's just like if I get hurt, I'm gonna be stuck with that bill type of thing.
Right.
So like, what if like I'm still on that? But like, what if I get in a car accident here?
It would probably be financial assistance.
Okay.
You know, depending on where you are going to stay long-term, you know, if this is not gonna be your long-term home, then it really isn't gonna make sense to apply for any type of a Medicaid or anything like that. So probably, and you know, unless you have something, a car accident isn't gonna get you Medicaid. So that's gonna be a financial assistance. So, does that answer it? Perfect? All right. Any other questions about Medicaid? Okay, we're gonna talk about the marketplace insurance, and we are in open enrollment from November 1st to December 15th. What open enrollment means is that this, from November 1st to December 15th, anybody can apply for any reason, okay? So if you're in need of insurance, your insurance has lapsed, anything like that, you can apply during this time, and we're gearing up for that because it's going to be a busy time. If you don't get enrolled in that time, that is considered special enrollment period. And the special enrollment period, you have to have identifiers like you had a baby. They call it life-changing events. So you've had a baby, you've lost your job, you got married, and I'm married, divorced, you've lost your insurance or within the past 60 days. Or had a, yeah. So, for instance, my son turned 26 last year. So on the day of his 26th birthday, my insurance stopped covering him. So he had 60 days to get an insurance plan. And he could have applied, that did not happen in open enrollment, so he could have applied for the marketplace insurance at that time. So that's a special enrollment, but we're opening up November 1st into our open enrollment. Prior to the new administration, you had a penalty on your taxes if you did not have insurance. That penalty is gone, and that's a double-edged sword. That makes a difference for some people in whether they will find coverage for themselves or whether they will not. The only thing that I can say to you at this point as a college student, you're young and you have a lot of life ahead of you, but you never know when something's going to happen and you're going to need to be in the hospital. So don't totally ignore the opportunity to look at the marketplace insurance. The one thing I'll tell you is I've seen premiums as low as $0 because of the tax credit and the income of that applicant. We've seen them high, depending on what you choose. You get multiple options. I think the last application I did, we had 5 options. So you can choose a deductible. A deductible is how much you're responsible for before insurance pays at 100%. Most insurance pays at 80-20, which means they pay 80%, you pay 20%. A lot of the marketplace programs are 70-30, so they pay 70, you pay 30%. But they will start paying at 100% once you've hit your deductible. Now those numbers can be very high or they can be lower. It just depends on the plan that you choose. So for instance, you want a really small premium, right? You want to pay $25 a month. Your deductible is going to probably be $10,000. So then you got to think about that. What am I going to do to pay that $10,000 if I end up in the hospital, right? So maybe you want to go to a plan where it's $75 a month for your insurance, but your deductible comes down to $3,000. Okay? So there's multiple options. We can run through the application. You don't have to accept anything. We've done applications and people have gone home and thought about it for a few days and they come back. So there's lots to do, but the marketplace insurance offers exactly what the name states, which is an affordable insurance for people, real people who are trying to survive. If we find in that application that they do not offer anything that is affordable, which means it has to be 10%, it's actually I think like 9 point something.